Hello everyone, welcome back to my channel. So today let's discuss the what are the causes of low blood pressure, that is hypotension. First we are going to see what is blood pressure. Generally the heart pumps the blood through blood vessels to various parts of the body. In these blood vessels, how the blood flows is measured by blood pressure. Normally the BP level will be 120 by 80 millimeters mercury. But in certain conditions, the BP will be less than 90 by 60 millimeters mercury. This condition we call it as low BP or hypotension. There are various causes of hypotension. The first important cause is dehydration. Dehydration may occur because of vomiting, loose motions, low water intake, fever, and other causes. And one of the most common cause for low BP is blood loss. That is, whenever in periods there will be bleeding, and whenever there is accident or any ulcer in the stomach, there will be blood loss. And for this blood loss, the BP level will be down. So automatically there will be a decrease in the blood pressure levels. So we know that the heart pumps the blood. If there is decreased in the heart rate or certain heart problems like arrhythmias or viral stenosis, and in people who take antihypertensive drugs like metoprolol, antidepressant drugs, and many other drugs, in such conditions there will be a low blood pressure. And low BP is also very common during pregnancy, because in pregnancy certain hormonal changes, the blood vessels dilate. Whenever the blood vessels dilate, automatically the blood pressure will be reduced, and this condition is more commonly seen during the first trimester, that is 24 weeks of pregnancy. And this low blood pressure can be automatically cured once the delivery is done. Low BP can also be seen during some hormonal changes like Addison's disease, hypoglycemia, and certain nutritional deficiencies like vitamin B12, folate, iron deficiency also causes low blood pressure. There are various types of low blood pressure or hypotension. The first is orthostatic hypotension or postural hypotension. So in this, a person suddenly stands up after long sitting or after prolonged sleeping. So in these cases, the BP will suddenly fall, and such condition is most commonly seen in older people, and the common causes dehydration, pregnancy, long-term bed rest, and certain medical conditions can also cause this postural hypotension. The second type of low BP is postprandial hypotension. So in this occurs in certain people where blood pressure will fall immediately within 1 to 2 hours after eating. So this condition is called postprandial hypotension, and this hypotension is also seen in older people who have high blood pressure and in conditions with Parkinson's problem. To overcome this postprandial hypotension, we should eat small and low carbohydrate meals. We should drink more water and should avoid alcohol to reduce this postprandial hypotension. The third type is neurally mediated hypotension. So in these people, the BP falls immediately after standing for long periods. People who stand for long periods, in such condition, their blood pressure levels will fall, and this hypotension can also seen in young adults, children. It is most commonly occur because of imbalance or miscommunication between the heart and the brain, coming to the symptoms of low blood pressure. So as we all know, if you have low blood pressure, then the blood flow to all organs is very less. So common symptoms are weakness, dizziness, sweating in the hands and legs, body becomes cold, and there will be severe tachycardia. In severe low blood pressure conditions, there may be dizziness and confusion. So coming to the diagnosis, how can we diagnose low BP? So we can diagnose the low BP by checking the blood pressure and certain blood tests like hemoglobin, sugar levels, and ECG to diagnose any heart problems. So let's see the treatment, how to treat low BP conditions. So it usually depends upon the condition. If low blood pressure is occurred because of dehydration or vomiting, loose motions, so we should do treatment accordingly. So generally, to avoid dehydration, we should take high fluid in water intake, electrolytes, and severe conditions saline should be given, and doctors may prescribe you certain tablets like fluid or cortisone, middle drain, etc. If low blood pressure is because of the blood loss, then there may be chances of blood transfusion should be done, and if low blood pressure is because of certain tablets, that doses should be corrected. So diet plays a very important and crucial role in maintaining your blood pressure levels. So certain fruits are very important for low BP, such as high beetroot juice, pomegranate juice, wheatgrass juice, and we should eat in very small quantity and low carbohydrate meals. So friends, I hope you like my video, and if you like it, please do share and subscribe to my channel to and support me.